Good morning, everyone. Today topic corticosteroids. The corticosteroids are belongs to this suprarenal gland in the cortex and medulla is there. That corticosteroids are synthesized in cortex of adrenal gland. Okay, in this one they are powerful anti-inflammatory drugs. Coming to the classification, glucocorticosteroids and mineralocorticosteroids. Two types are there. Glucocorticosteroids are hydrocortisone, prednisolone, methylprednisolone, triamcinolone, betamethasone, dexamethasone. Mineral corticosteroids are desoxycorticosterone acetate, fludrocortisone, and aldosterone. In this one, hydrocortisone and prednisolones are important one. And all the drugs mechanism of action of this one, they act in the receptor mediated. Okay, the specific receptor is present in the cytoplasm. The drug receptor complex will be formed and it will transfer the nucleus and it binds to the specific DNA and generate the synthesis of new proteins. Okay, the transcription and translation will be occur, new proteins will be synthesized, that will be give the response. Coming to the pharmacological actions, it's a very important about glucocorticosteroids action. First I am discussing the mineralocorticosteroids action. Highly effective sodium and potassium and fluid balance. Okay, in mineralocorticosteroids they will be increase the sodium and water retention. Coming to the glucocorticosteroids, they will be effect on carbohydrate metabolism, protein and fat metabolism. Carbohydrate metabolism, they will promote the glucogenesis, leads to diabetes mellitus, and protein metabolism, they will enhance the breakdown of proteins, and fats also will be increase the fat metabolism, lipolysis. Redistribution of fat will be there. That's why in Cushing's disease, pot belly, buffalo hump will be present. Coming to the anti-inflammatory action of this mineral and glucocorticosteroids, they will suppress the development of inflammatory response to all type of stimuli, inhibits both late and early manifestations of the inflammation. Such cells mediated immunity prevents the manifestations of allergy. Okay, it is having very good anti-inflammatory and immunosuppressant action. Based on these two actions only, so many uses are there. Okay, I will discuss later what are the uses. Coming to the calcium metabolism, the absorption will decreases and excretion will be increases. Okay, so calcium is losing, bone diseases will become osteoporosis, osteomalacia will become. In cardiovascular system, it is increasing the sodium and water retention, hypertension will be there. In skeletal muscles, there will redistribution of fat leads to the and weakness of muscles can be occur. And CNS disturbance, euphoria can be occur. In stomach, increase the gastric secretions leads to peptic ulcer. In lymphoid tissue, it is increase the destructions of lymph nodes and increase the RBCs, neutrophils and platelets. Those are the pharmacological actions. So only therapeutic uses having the very important question. They will ask in examination point of view only uses. Replacement therapy and pharmacotherapy. The replacement therapy is nothing but adrenal uses. Pharmacotherapy is nothing but non-adrenal uses. In replacement therapy, it is useful in adrenal insufficiency, either chronic and acute, and congenital adrenal insufficiency and adrenal hyperplasia. So in that adrenal having three uses. Coming to the non-adrenal, it's useful in arthritis, nothing but inflammation, rheumatoid arthritis, inflammation, osteoarthritis, inflammation, rheumatic fever, inflammation, gout, inflammation, collagen diseases, systemic lupus erythematosus syndrome, glomerular nephritis, inflammation, severe allergic reactions, antigen antibody reactions. Okay, inflammation. And coming to not only inflammation, it can be useful in autoimmune disorder because of it is will be having suppress the immune system. And bronchial asthma, bronchitis, okay, inflammation, lung diseases, pulmonary edema, aspiration pneumonia, hypersensitive reactions, infectious disease, tuberculosis, and severe lepra and severe tuberculosis only this drug is useful. And eye inflammation, keratitis, iriditis, itis, and allergic conjunctivitis, in skin dermatitis and Steven Johnson hypersensitive reaction, and ulcerative colitis, cerebral edema, and malignance also can be useful one. Okay, in cancers will be useful, and organ transplantation and shock also. These drugs are more and useful because of anti-inflammatory and immunosuppressant action. Coming to the adverse effects of these mineralocorticosteroids and glucocorticosteroids, they are having mineralocorticosteroids hypokalemia, hypokalemic alkalosis will be occur. In this rises the blood pressure, leads to BP. And glucocorticosteroids, Cushing's habitus, this is causing a diabetes mellitus, and then it is having signs and symptoms of diabetes mellitus, hypertension. Okay, and this all the side effects will be present: hyperglycemia, muscle weakness due to potassium changes. Okay, delayed healing due to increase the glucose, diabetes mellitus, peptic ulcer, increase the HCl production, osteoporosis, and increase the calcium excretion, glaucoma, increase the intraocular pressure, growth retardation will occur. Okay, bone epiphysis, metaphysis will be closes, fetal abnormalities will occur. It will transfer. It is transferring to the placental barriers. Okay, and psychiatric disturbances will be there. Due to it causes the euphoric effect. If you use a longer time, it will suppress the hypothalamo hypophyseal axis, then completely that normal glucocorticosteroids production will be stopped. So we have to withdraw this one. If you want to stop these corticosteroids, tapering dose should be there, and short term using steroids are better one. And fragile skin, purple stripe will become, and skin infections can be occur. So important thing about contraindication, we should not useful this drug in a peptic ulcer because it is increase the HCl production. Diabetes mellitus, it is increase the glucose production. And hypertension, increase the sodium and water retention. And viral infection, it is causing autoimmune, it is immune system depression. And tuberculosis is not useful one. Okay, inflammatory action, but tuberculosis, it is increase the bacterial growth. In severe condition can able to useful one. Osteoporosis, it is increase the calcium excretion. Psychosis, it causes the euphoric effect. Epilepsy, euphoric effect. Congestive heart failure should not be useful. It is increase the edema. And renal failure also, it is increase the edema. So these so many uses are there, same like that. So many disadvantages also is there. So we should not useful this drug in these contraindications, absolute contraindications. Okay, so that is over about this class. So please remember first classification. Okay, so these are the glucocorticosteroids and mineralocorticosteroids. Okay, glucocorticosteroids short acting, intermediate acting, long acting. And mechanism of action, it acts on receptor, transcription and translation, pharmacological actions and metabolic effects. Pharmacological actions, anti-inflammatory and immunosuppressive action is almost all type of inflammatory action it will be blocked. Okay, so what is the inflammatory action? Means it is suppressing the antigen antibody reaction. It is useful in hypersensitivity reactions, and it will form the one coat. Okay, antigen antibody will be suppressed, and all type of the stimulus can be blocked. Hypersensitivity reactions, all types of stimulus will be blocked. So corticosteroids are best drugs for useful in any type of the inflammatory diseases. Okay, so like that, therapeutic uses, so many uses are there. Adrenal uses and noradrenal uses, so many things are there. Okay, then it is useful in some anti-inflammatory action, same in autoimmune disorders also. Okay, autoimmune means the immune system overaction leads to own antibodies will be attacks the own bodies organs. So like that, thrombocytopenia, chronic hepatitis, and systemic lupus erythematosus, and some thyroid diseases. Okay, so this drug can be useful in autoimmune disorders. Okay, and that one, adverse effects also much more is there. Mineralocorticosteroids only one adverse effect. Glucocorticosteroids are more and more adverse effects. Okay, main thing is Cushing's habits. In this one, all adverse effects we can see in Cushing's disease. Okay, like muscle weakness we can see, peptic ulcer we can see, osteoporosis you can see, glaucoma will be there. So you see the diagram of this Cushing's habits or Cushing's disease, you can understand much more. And coming to this one, contraindications are that also very important thing. Definitely we should not use these drugs in the particular situations. If we use, so some disadvantages will be there. So if example, already peptic ulcer is there, so if we use more, ulcer will become, leads to much more damages, patient complaints will be increases. Like that in hypertension, already hypertension is there, but even if we use this one, Okay, what happens? More BP increases, internal organ bleeding can be occur. Patient can be suffer much more. Same thing in congestive heart failure. Okay, okay. Thank you for listening. I'm stopping the class.